All right, kids, Dr. Shepard here, and we are going to do something a little bit different today. Do you guys know who Dr. Mike is? If you don't, please go subscribe right now because he's hilarious and he's been doing like these awesome medical meme reaction videos for a while and they're pretty funny. Anyways, so we're going to do a reaction video to the funniest Onion psychiatry / psychology mental health inclusive Onion articles that I could find. So let's do it. All right. Woman's subconscious not sure how much more clearly it can communicate that her teeth are going to fall out soon. Do you guys have that dream? Let me know in the comments if you do. I definitely have before, and I read somewhere that it meant that you were sexually frustrated. I don't think that's true, but maybe it is. I don't know. People do ask me sometimes, what do dreams mean? Like, do they have any meaning to them? And generally the answer is, I don't know that they do. There's not a lot of good science behind it anyways. But if people sort of inject their own meaning into the dream, then that can be kind of meaningful. For example, the teeth falling out dream, like if I got really concerned about the idea that I might be sexually frustrated as evidenced by these dreams, like that might be meaningful. Like, why am I so worried about whether or not I'm sexually frustrated? Anyways, sorry, that's a little, we're going PG-13 in this one. But there are very real sleep issues that we deal with. So like, for example, REM behavior disorders or RBDs. So that's times when you're supposed to be essentially paralyzed during REM sleep so that you can have dreams without enacting them. And something goes wrong with that system and you start acting out your dreams. So people will do things like get into fights with their like partner in a dream and then start like hitting them while they're next to them, or they'll get up and sleepwalk and eat. All sorts of crazy things. So that happens more often in people with some underlying neurological issue, like Parkinson's disease is sort of a classic, but can sometimes happen in people that don't have any diseases at all. Another interesting psych fact is that SSRIs in particular, so things like Zoloft, Prozac, Lexapro, all of those sort of class of medicines can actually cause you to have really vivid dreams. And that can be something that actually gets to the point of being really bothersome for some people. So we have to reevaluate the medicine that we're using. Okay. Terrifying new therapist asks why you chose that chair. That would be terrifying. I've definitely never asked anybody that, but it is kind of interesting to think about it, because I remember thinking like sometimes I have patients that like sit in the chair that's like uncomfortably close to me, and then sometimes I have patients that like sit all the way in the corner. It is kind of interesting to think what that might mean, but probably just reflects their level of comfort with you or how strict their like average social boundaries are. But yeah, not sure that that would be a very productive therapy session if we're just talking about which chair you sat in. But whatever, that's fine. You gotta do your own thing. Okay. All right, that's sad. As I laugh, only person who ever truly saw a world for what it is starts antidepressant medication. All right, it's a stretch, but I kind of tell my patients something related to that, because everybody like totally feels like they're abnormal for being anxious or depressed, or they feel dumb, or they feel like they're out of touch with reality. What I tell people is that's simply not true. So honestly, with most depressed and anxious people, the problem isn't that we're out of touch with reality, it's that we are way too in touch with reality. So if we could use a little bit of those rose-colored glasses from time to time, we'd be much less likely to get depressed. All right, this one's pretty good. Learning to love himself, getting man out of a lot of painful self-reflection. So, fair. That's fair. But I would argue you can do both at the same time. So you can love yourself, but still not necessarily want things to stay the same. Oh, the best quote I've ever heard about this was, you can be both a masterpiece and a work in progress at the same time. And I was thinking about that. I was like, dang, if like Rembrandt was painting something like, and we, uncovered it partway through the painting, like that would still absolutely be a masterpiece, even if he didn't finish it. And that's like so true of all of us. We can totally love ourselves, but still be a work in progress. I know I absolutely am. But it's also fair to say that that self-reflection can be pretty painful. So sometimes we don't start therapy until people are on a good dose of medicine and they feel like their symptoms are somewhat controlled, because it's going to be really, really hard. It's going to dig up a lot of difficult feelings and emotions, and you may not be in a place to be able to handle that when you're really depressed. So that's an example of why, when we would admit people to the hospital for inpatient psychiatry who, for example, had just had a suicide attempt or were very suicidal, so very, very ill people, sometimes family members would ask us, are we going to do therapy on the unit? And in a way we kind of do. So we do something called supportive therapy, which is just like encouraging the person, helping them get through this really difficult period of their life. But we don't necessarily do like traditional therapy where we ask them about their mother and childhood and like do cognitive behavioral therapy exercises, because it's simply too hard when you're in such a vulnerable and difficult state like that. Okay. American Psychiatric Association, aka the APA, adds obsessive categorization of mental conditions to DSM-5. For those of you who don't know, the DSM-5 is a system by which we categorize different mental illnesses. I guess that was pretty obvious based on what I just said. Anyways, so it basically puts each disorder in a category and then sort of describes the disorder a little bit and talks about the most common symptoms that are associated with that disorder and what criteria people tend to need to meet to be able to participate in research protocols. It's sort of a standardization manual. A common type of question I get is, XYZ isn't in the DSM, or this symptom isn't in the DSM, this disorder isn't in the DSM, or the DSM says this about this disorder, like what does that mean? And what I tell people is the DSM is more of a research tool. So some people think of psychiatry or therapy as being like cookbooks, and you just like pull out your DSM and you're like, all right, this one fits. But that is not the case. So I honestly almost, not even almost, I never use the DSM in day-to-day clinical practice. And that's because we rely a lot more on our clinical knowledge than we do on some kind of cookbook of recipes. But the DSM is pretty useful for research studies. So when we're doing a research study, we want to make sure that we're actually studying the same illness in different people. So we want to have things a little bit more standardized. That's going to mean that the study is going to have less external validity, because you're not going to be able to extrapolate that to other members of the population that may not fit that criteria exactly. But it does make it easier to conduct effective research studies. Nation's therapists say majority of issues could be resolved by not being so weird all of the time. Okay, I hear you, but I'm just saying those of us that work in mental health are definitely the weirdest ones. You can't out-weird us. Like, you just can't. And even if you think you can, we've definitely heard it before. All right, guys, so I know that's a little bit different than what we normally do around here, but if you like this kind of video, let me know. It's kind of a fun way to spread information about psychiatric issues. So let me know if you want me to do more like this. And if you're not subscribed already, I would super duper appreciate it if you were to subscribe and hit the notifications bell so that you know every time I post a new video. All right, see you guys later.